Okay, we're going to check out the other order sets. And obviously to get to them, you hit orders. And sets are already brought up here. We're going to go to pediatrics. And the first order set we're going to look at is probably the most common to be used, and that's called Peds Favorite Medications. We're going to go ahead and hit view those. And this is a list of medications that are going to be most frequently used in pediatrics by far. The medications are grouped by type of medication. There's antibiotics, antivirals, which is essentially acyclovir. There's Tamiflu, analgesics, non-opioid, analgesics, opioid, respiratory medications, gastrointestinal medications, neurologic, psychiatric. Okay, so the great majority of medicines you order are going to be in this order set, I believe. And let's go through this a little bit. So as you can see here, it auto-calculated 80 mg per kg per day divided Q12. So this should be 65 times 40 PO-Q12. As you can see, that's way high of a dose because our patient has a high kilogram relatively. However, for little kids and babies, this should be an appropriate dose. To get this to change, you can either click it now and just wait for it to go through, or again, we'll go ahead and hit calculate 80. This is high dose Amox. There are other choices of Amox, so there's standard dose or high dose, one time dose. So we'll go ahead and click this, and good thing it maxes out at 800 milligrams, which I think is what I do. 800 milligrams PO-Q12, it maxes out. That's more appropriate. There's ampicillin for community-acquired pneumonia, children that can't take PO. Looks like this is there's two formulations, it looks like, for pediatric patients less than 20 kilos, and for pediatric patients greater than 20 kilos, it's actually the same dose it calculates. And I think pharmacy has two options because one is a smaller bag of ampicillin, and this might be a bigger bag of ampicillin. Here's azithromycin, 5 mg per kg per day, assuming that they may have already gotten the 10 mg per kg dose on day 1, either in the ED or you could order that separately. And this is the 250 for 4 days for adult dosing. Alright, I'm not going to go through every single one of these medications, but again, just review them carefully. But I will go through ones that are different. So let's look at acyclovir. So there are 3 options for acyclovir. IV for pediatric patients less than 35 weeks post-conceptual age. And this is the dose. And this is for pediatric patients greater than or equal to 35 weeks post-conceptual age. And this is the dose. This is stolen from the Harriet Lane, or Neofax, I guess. But again, just always make sure this is correct. You may find an error, and then you can let me know and we can change that with pharmacy. Always double check in the Harriet Lane. This is acyclovir for pediatric patients greater than 12 years of age, and that's the dosing used for them. I would also check the Harriet Lane. Also Tamiflu. So this is for treatment of influenza, not prophylaxis, but treatment. And as you can see here, this is you're going to order this a little bit differently. There's no milligrams here. It tells you down here in the protocol how much to give, because Tamiflu is not based milligrams per kilogram, but it's dosed by age. So we can see that a little bit more if we bring this edit up and we go down here, and this is infant dosing. So I would have to say, okay, our kid's 4 months old, 20 milligrams PO BID. Was it 20? Yep. So I'm just going to put in 20 here. PO BID scheduled. I'll go ahead and order that. Do we want it now, or do we want to start it at 10 o'clock tonight? Go ahead and start it now. I don't know. Whatever you think is best for that patient. So I check it 20 milligrams POBID. And this Tamiflu is weight-based dosing. Now for infants, it's age-based dosing. Once you get over a year of age, then it switches the weight-based dosing, and it tells you right here what it is. And it's not mg per kg. It's just if you're 15 to 23 kilos, you order that. Okay, so Tylenol will go down. So I think otherwise this order set is pretty self-explanatory. Zofran is also a medication that is dosed a little bit differently. It's not exact mg per kg. It's 8 to 15 kilos. Then you give 2 milligrams PO. Just be careful again, and most common medications there. So I'm going to go ahead and order the medications that I checked, and let's see what happens. The Amox, do we want to give it? We'll start the Amox at 10 o'clock tonight as opposed to tomorrow or now, so that's fine. I'll go ahead and hit OK. Allergy. Oh, I keep forgetting about that penicillin allergy. You know what? I'll just go ahead. I can't give Amox if they have a penicillin allergy. Maybe I'll go back on history and clarify exactly what it was. But I'm just gonna hit erase this order because patient allergy. I don't know. Okay, so this is interesting. It is asking me, why am I ordering Tamiflu? I never even ordered a flu test, or there's no positive flu test. But heck, I still want it. And as you can see here, the only new order I'm ordering is 20 milligrams POBID of oseltamivir. It got rid of the Amox. And note that it's still letting me order Tamiflu even though I didn't order a flu test. I'm going to go ahead and hit save and enter that order. So that's the favorite medications order set. Let's look at a couple other order sets. A lot of medications ordered on this patient. So again, here are the order sets. New onset diabetes. Let's look at the ped surgical post-op orders. This is for obviously patients post-op. It may also be helpful for patients pre-op or in the surgical realm. You'll just have to take a look at them. SCDs, TEDs, JP drains. Here's some laboratory orders. Now this says a CBC with diff, T +1, so today +1, tomorrow at 6 a.m. If you want morning labs for your patient, that's what you order. And surgeons do like morning labs, but obviously you touch base with them or think if you're going to want morning labs. Some common surgical antibiotics are all here. And some analgesics, and my favorite medication. Ooh, they don't have Miralax here, but that's okay. You'll have to order that separately. It's in other order sets anyway. Other order sets: IV immunoglobulin or IVIG. Okay, this is a order set that is intended for ordering IVIG on patients. Take a note that if you hit this little button here, it'll take you to the Kawasaki guidelines. Pretty cool. So I recommend reading through that before you're giving IVIG. IVIG protocol. This is the nursing protocol to what they're going to do when giving IVIG. There's an order for an echo. And there's only one other order. Oh, there's a couple, I guess, aspirin and Benadryl. But really, the main order here is giving the IVIG. This makes it simple for you guys. All you got to do is click that button. Well, you should definitely read this. This is the way that IVIG should be given. You should read the risk factors, make sure there's no risk factors, and consider that. And let's go into the order itself. IVIG is 2 grams per kilo. And obviously it maxes out at something, and that something happens to be 100 grams. There's some other data in there for you. to look at. Now you can't read all of this. See how it goes dot dot dot? You can't read it. It's a problem with Meditech. So what we did was, I'm going to hit the accept dose, was we simply put that information up here so you can read it carefully. Aspirin is typically given 100 mg per kg per day divided Q4. Given 4 times a day. Go ahead and hit OK. It exceeds the maximum dose. And again, I would double check that with the Kawasaki guidelines and make sure that is okay. So we got our IVIG ordered. We got our aspirin ordered. We got our nursing protocol. They take vital signs every 15 minutes twice, and then every 30 minutes or whatever the protocol is. Also, there's a link to the protocol. Pretty cool. So I'm going to go ahead and hit OK. And it wants some information. Are there risk factors for nephrotoxicity present? No. Are there risk factors for thrombosis present? No. And it is up. I'm ordering aspirin, but I've already ordered a lot of other NSAIDs and analgesics. But you know what? I'm going to go. This patient needs aspirin. I'm going to go ahead and say it's an accepted therapy. I'm going to override that. Here are my orders: the protocol, the IVIG, the aspirin. Boom. I'll put those in. That's the IVIG order set, intended to make it really easy for you and safe. Before you had to write it all out and check it. Now, PEDS hyaluronidase is another order set intended to make this simple. PEDS vaccinations, terbutaline. Take a look at that one carefully when ordering. Psychiatric orders and new onset diabetes. Let's take a look at that one quickly. So this is not for patients in diabetic ketoacidosis. This is for patients who have new onset diabetes or who come in with diabetes when they're not in diabetic ketoacidosis, or when a patient is done with their diabetic ketoacidosis and you're ordering more maintenance diabetes medications. Obtain blood glucose, obtain ketones. These are some labs you want to order on patients with new onset diabetes, celiac disease, thyroid, and those ones. Diabetic diet. Here's some insulin, Levemir, long-acting medication, and it automatically calculates to 0.5 units per kilo per day. Obviously, you want to touch base with the patient and or their endocrinologist to make sure that this is what they're on or what they want to get. This is something you definitely want to touch base with to make sure the endocrinologist or what the patient's baseline long-acting medication needs are. Here's some mealtime insulin per carbs, 1 unit every 10 grams of carbs. Now you could change this to give you know, all this says is sliding scale, give 1 unit for every 15 grams of carbs if they're on that. Okay. And that cues the nurse to give 1 unit for every 15 grams of carbs. And here are carb ratio for breakfast, lunch, or supper. I like supper there instead of dinner. So 1 unit every 10 grams, 1 unit every 10 grams. Sometimes breakfast, lunch, and supper is different. And this is snacks. And this is your correction. Okay, 200 to 240, you give 1.5 units. This is one way to do the correction, and guess what? You could change this. You could change these values. You have to hit your down arrow key to see the rest, and you can change the glucose. So I think it's pretty easy. Easy thing. Okay. Go ahead and order that one. Why is it? I guess I'm ordering a couple different insulins, but patients, that is normal to order a bunch of different insulins. So I guess there's 2 there ordered. Okay, I think that is good for the order sets.